This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Welcome to the Optimal Wellness Podcast, inspiring you to live a healthier lifestyle. I'm Dr. Fetters here at Health and Wellness, and I'm here with Jenna Toupin, my nurse practitioner.
So today we're going to be talking about mental health. Tell the audience a little more about how often we talk about mental health with our patients, what we do in the functional role, and how we usually manage it. Is it prescriptions? Is it supplements? Is it a combination of both? And so what do we usually do?
So we discuss mental health at every visit.
Yeah.
To be healthy, it starts with your brain. It's your thought. Those with very little money, little means, but if they have a positive attitude, the world is bright and wonderful. Yeah, it's true. We see it all the time. Of course, the wealthiest people have so many things to worry about. So if you worry about your 3 businesses and 100 other things and 10,000 employees, unless you have the right mental state, it can either bring you up or bring you down. So your health is more dependent upon mental health than anything. And so we talk about every time. The nurse, some people actually will open up to my front office. We have lovely front office. They will tell the front office staff, they have to tell me on the way out the door. Yeah. It's funny. But some people feel more comfortable with front office staff. The nurses we have caring, compassionate nurses. They talk about it, and then I open up to them. And then if needed, then if I'm not the right person, Jerry Weber is my naturopath, who's one of the best in the world for emotional releases. So we love Jerry. And then my other practitioners here, sometimes they connect better. But as I get older, it's like man or woman, it doesn't matter. When you get to be grandpa's age, it's like people now tell me everything. Sometimes women had boundaries and stuff, but like at my age, it's like, I hear it all. So I like hearing it all. There's a lot of people that don't like to go deep, and I love to go deep. I mean, I consider psychiatry. I love psychiatry. Holistic health is so amazing because now we know that in holistic health, mental illness is a lot of part, it's physiological. From the nutrients and the lack of minerals and chemicals and neurotransmitters. So it's my favorite part of practicing medicine, and I think it has the most benefit, and it's not costly to improve your mental health.
Yeah. And also, I know I talk a lot about the microbiome, so your gut, but also what 80 to 90% of your serotonin is created in your gut.
Right. Oh, absolutely.
So gut health is huge for mental health.
And actually, one more thing, because I'll forget, it's up in a conference, this pediatric ophthalmologist, pediatric neuroscientist, ophthalmologist, was talking about screen time, how damaging it is to the brain. Yeah. And the research shows these kids that are on their screen for hours a day, when she does a SPECT scan, which shows the anatomy and physiology of the brain, she can't tell the difference between if they're on cocaine or addicted to horrible drugs or if they're addicted to that phone. That constant dopamine hits is just like drugs, so the brain damage is as if you're... And the good news was, I would have thought it takes 6 months for these kids to recover. In 3 weeks, total abstinence,
really? Wow.
3 weeks, and within 24 hours, the kids, again, the parents have to be disciplined. They start talking, okay, Mom, what do you do? They actually become normal. It's like because humans are designed for close contact with others, and their behaviors return to normal within days, and within 3 weeks they're off of it. Yeah. So probably one of the most, and it works for adults too. It's like, you know what, you need to be outside. We are humans that need to be in contact with other humans. We are the most social beings of all animals, and when you're on that phone, it's so much easier to be on that. But man, get rid of that thing. Be with people. Communicate with people, do stuff with people, use your phone as the tool, but not as if it's your main source of enjoyment, energy, it's going to harm your brain and most importantly, your mental health.
Yeah, social media definitely has a tendency to make us feel like we're connected, like we're actually socializing with people, but it's having that face-to-face contact is really important. How would you say the difference? It's pretty obvious, but like the approach from holistic versus traditional when it comes to mental care.
Yeah, because
pharmaceuticals, obviously.
Right. Because I remember the day the Prozac came out. But it was amazing. If you were depressed and biochemically, it was the most effective, safest. And the cool thing that Lilly did is, they didn't promote Prozac. They knew they had the best product, so they were back before we were born, depression was a dirty word. mental illness was you were ashamed. You would never, if you were depressed, you would never tell anyone.
It's changed a lot.
So Lily said, okay, so we're going to make mental health and not a dirty word and just elevate it in the public's mind as a biochemical disorder. And that's why they just blew every record there was, because they had the best product.
Yeah.
But now we know that there's a place for psychiatric meds. Same thing; they were so expensive. Now they're all basically free. So if you are suicidal, I will use prescription drugs, and in 24 hours you can feel better. The prescription drugs are amazing. That if it's really advanced, out of control with the psychiatrists, they're the masters of manipulating the neurochemicals. But the average person, there's natural ways to rate. The natural, we already talked about the natural things, your exercise, your diet, your sleep, who you associate with, getting up. Social media is so negative. And it's, actually, so your father and I grew up in the 60s and 70s. You realize that I was born in 59. You realize, so I was in the 60s. So I'm truly a child of the 60s. I was born in 59. And all my girlfriends, all my friends, it was love, peace, and understanding. And I remember I was so like the most the hippie, the most hippie, chill girls. That's those I was attracted to. They were just literally just love and peace. It's just so amazing. And these poor young people today, it's like all this doing social media, it's all about the money, the look, fillers and Botox and 17-year-old girls, and money and materialism and cars and sex. And it turns out to be so demonic and negative, and it's all fake. So these young, I feel sorry more. It's bad for women and boys both, but I think it's worse for girls. It's like this illusion that all these other girls are beautiful. They do everything right, and then behind the scenes, then they're depressed and all this stuff. So it's so fake, and we just need to get people back in reality and what really matters.
Yeah. What changes can the average person make for their mental health?
Yeah,
and treating their symptoms.
Probably number one is
we already kind of touched on it.
Yeah, physical activity. Actually, there was a study shortly after Prozac came out, and Prozac was the best antidepressant, and exercise 30 minutes a day was equal.
Yeah.
Gee, what's other health? You don't have heart disease. And it's for mental health. Obviously, exercise, being outside is so important. And if I'm not that social, so when I run, I like to be in the lone piece. Now, trail running and being in with Mother Nature, that adds another level of peace and tranquility.
But you don't run. You roller skate.
Yeah. So I had a.
You got to be honest with the audience.
Okay. So I had a car accident, so I cannot run.
It's cool.
Because there's always running was my life, and then I had this car accident, and I
didn't know that.
Yeah, so I've in my ankle there's a bone that has a wall about 1 millimeter thick. So if I break it, then I can't. I will be fine, but I can't. Well, I will not be able to walk for 6 weeks and blah blah blah.
Yeah.
So I started rollerblading, and there's no trauma. So it's so fun, and it's more fun. And actually, because I was in California when it just came out, I was at Muscle Beach, and I remember they had it, and I had to have them. And
it's better on your knees too.
Yeah, but there's no other than just if you're my age, don't start rollerblading. If you fall, you kill yourself. I've been doing it.
We do not advocate rollerblading.
I've been doing it since I was 25, so it's fun. But downhill skiing, wakeboarding, kiteboarding, all those things. You can do so much, even if your joints aren't perfect. So sleep. So all these people on their cell phones, guess what? They're up all night long. You need to be off screen time. So the neuro-ophthalmologist, she said, 2 hours before you go to bed, your brain takes that long to calm. You don't get restored. If your brain's activated right before going to bed, you never get restorative sleep. You need to stop it. I do use my blue blockers.
The blue blockers.
So I have one that are clear in the morning. And then I've got darker ones at night when I'm on the screen. Just my eyes tell me when I'm not using it. My eyes start telling me, "Wow, it's a problem." Yeah. Oh yeah, the neuro-ophthalmologist. She also said, "Here's two." It was so fun listening to this lady. Number one, your child. I know I feel sorry for the parents. I know you're working 3 jobs, but when you have a child, a baby or someone under 10 years of old, all 3 layers of your eyes being damaged just from the radiation. Yeah. And the government just came out, whoever that is, so there's no damage from cell phones. There's absolutely evidence, all layers. And my sons all love soccer. Why does the United States get beat by these third world countries with can't even afford a ball? And she didn't make this association, this is my association. For you to see in 3D as a baby, you need the human brain and eyes is meant to look distance, short term not. So these kids are not developing 3-dimensional vision. So guess what? These guys in Africa, they're not on cell phones. They're
That's why
playing.
they're
They're with. That's why they kick our butt. It's like because
there it is.
Our guys, as soon as they're done playing soccer, they're like this, and they're just their 3D perception is impaired.
Yeah. So anything else in regards to mental health that you want to talk about? I mean, we talked about it's very multifaceted. We bring
and when everything is right, it's genetics. You know, I was alive.
For sure.
Maybe 25 years ago, this is such a great story. The Human Genome Project, billions of dollars went into this project because every pharmaceutical said, oh, when we know the genetic disorders, we're going to make so much money, we'll do that. Guess what? Mother Nature can move your genetics one direction or another, helps the gene expression, but no drug does. So it was the biggest boom for holistic health is when we do the genetic expression, we know who's prone to depression, anxiety based upon genetics. And everyone knows what the MTHFR mutation is. Well, if you're strong-willed and perfectionistic, 100% of all Olympic athletes have it because it makes you strong-willed and perfectionistic. Many good things, but as you know, it decreases your detoxification pathways. Well, scientists figured out many years ago, you don't break down folic acid. So they invented methyl tetrahydrofolic acid, and that negates it. People say, they come in depressed because they think they're damaged for life. If it's a partial mutation, heterozygous, you're down maybe 25% of normal. So you take the vitamins. And if you're double mutation, it's still 50%. Well, if you just do what you're supposed to do, you'll be better than the average person that doesn't do anything. Yeah. So that's why so our vitamins and holistic doctors' vitamins are more expensive than Walmart because methyl tetrahydrofolic acid is $35,000 per kilo and cheap folic acid is $15 per kilo.
Our bodies can actually use them.
Yeah, so we can know the whole genetics, and particularly for the methylation cycle. As you know, there are vitamins for each one of these mutations. When the wheels of methylation are turning, you make normal dopamine and serotonin and GABA. And then the side effects of that, then your liver works better, your cholesterol metabolism. So by knowing the genomics and knowing just that, and actually now that once you see enough people in the patterns, I used to do genetic testing on everybody, but now it's like the personality type you can and then we muscle test. So for people I learn a lot. I mean, they're still finding, it's cool because every time that they have a new gene that they decide all the things that work, it's all the holistic thing, all the things we already use. So it's amazing to have a supercomputer look at 25,000 genes of your patient. It goes down to 1,000 or 500. Then we get to look at those, and we get to look at the blood tests the patient has, how they behave. Because as you know, do you know this? Each one of your genes can be expressed how many different ways? How many different ways can one gene be expressed?
I have no idea.
10,000.
Wow.
So that's why we're all unique. So 25,000 genes expressed 10,000 different ways. So it's infinite amount. That's why the beauty of you find out what that shows, but you still have to see how's the person behaving, how's the blood test behaving, and then my muscle testing. Yeah. So between that, I hone them down. Even bipolar, even schizophrenia, if you can catch them early, you actually can reverse those diseases.
You told a story I think it was at the muscle testing conference about how you had a patient that you recommended, hey, just go out in nature.
Yeah.
I feel like that's so basic, but so helpful. Can you talk a little bit about that when it comes to mental health, like
absolutely.
being outside, sunshine, that kind of stuff?
Right.
I think you kind of already did, but emphasize it.
Okay. Well, I mean, so again, I'm ADD. So everyone in my family, all the men are hunters. But deer hunting, oh my God, you sit still for countless hours. You can't move, you can't pee. How horrible.
Yeah.
So I finally, the first time it got me up there in the deer stand, I'm sitting there, and I love the woods. I hike all the time. But when you're still for 30 minutes, the woods come alive. I mean, oh my God, all this noise that you never hear when you're walking.
You didn't kill any deer, though?
No, actually, I've never shot a deer in my life. If it's a trophy, I'd consider it, but still, it's for I go with my son and other people that love doing it, and when my son chooses, we eat every bit of it. So the world comes alive. It's like all the noise. So I mean, I remember this amazing, like a Cooper hawk flying by, and he didn't even see his wingtip touch the tip of my nose. I mean, how cool!
That's crazy.
It can be kind of scary. And then there's this big old, not the I don't know what kind of woodpeckers they were. There, a flock of woodpeckers landed like right above my head, and they're pecking at the tree. And I was scared to death. They started picking on me.
Yeah.
But just from mammals to everything, it's so calming and peaceful. It's like literally you're in a different world, and then okay, well, this is God's grace, so you're closer to God when you're through Mother Nature, and the beauty of Mother Nature from all the different when it rains, when it snows. One time there's crystals coming from my uncle has this amazing swamp, and you think this swamp is, oh my God, it's the most beautiful place in the world. And with the right temperature, these crystals start coming from the water up, and the sun hits it. So it's like you see rainbows from every little speck. It's like I just saw things that you could never see, never be even on TV. So Mother Nature is healing.
Huge. It's huge.
And grounding. I sleep on a grounding mat, but grounding every time Mother Nature, you just get the energy. When you hug the tree, when your back's against the tree, you're actually getting.
You do not hug the trees. Do you really?
Well, when you're hunting, your back is my head's against the tree. Actually, it's when it's windy, you're swaying with the tree. When it's windy, and then you trust Mother Nature that you're not going to break because or else you die.
Yeah, no, I understand what you're saying. Is there anything else that you want to add?
I guess mental health, the main thing is just connecting with other people and positive people. The way you think is who you're with. And just like in the news, as you know, 90% of all news. When I was younger, there was a time where 9% was positive news, where you make more people listen when it's negative news. Now it's 90% negative. There is the good news channel, good news app. And just follow positive people. I mean, if you're depressed, it's okay. Get rid of all the people and just go, who's the most positive, uplifting people in this world? If you should connect with a higher power. So, if you're just living for yourself, it's hard to be happy if you're just trying to please yourself. That the best way to be happy is help someone else. There's we're the Bible Belt here. There's churches every corner. Find a church that believes what you believe, and find a community. Join a group. When I came to town, I didn't know many people. I joined a hiking club, and they're all older people, but they were so chill. It's like they tell me, okay, this is where you go. Here's the best restaurants. Here's the place to get a car. It's like it was just connecting with people that aren't like you is pretty cool.
Yeah.
Well, thank you, Jenna. And thanks the audience for joining us. We appreciate you and your comments, and health is wealth.
Thank you for listening to the Optimal Wellness Podcast. Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to HWOFC.com